So a dose of MDMA has gone down from, in today's money, £50 to £2.50. About 5 people die from drug-related deaths at festivals every year. Most of those are MDMA overdose. These are totally preventable. They're usually young people early in their drug-taking careers. They've probably got low tolerance. Just last week, there was an inquest of a 21-year-old who died at a festival. He'd quadruple dropped 4 pills. At the end of the day, one of the things that's really heartened me is that most people do want to keep safe, and most people do want to hear those messages. So in some ways, I think you're knocking on an open door if it can be pitched in the right way. Ketamine is, pretty similar to cocaine and only slightly lower than MDMA now. It's become massively popular, and the age range has gone lower as well. So, if it was sort of 20, 30-something countercultural groups, now we can see it right down to people in their early and mid-teens. It's got to a situation where there are enough people with serious enough problems that they're going to A&E and at a younger and younger age, and more are. So, that needs to be addressed right through all the pathways, really, from people with that initial experimentation right through to people who have serious physical problems.
In this episode, I speak to Fiona Measham, who is a chair in Criminology at the University of Liverpool. She's also the founder and the chair of the Board of Trustees at The Loop. Fiona is one of the most influential people in the whole of the harm reduction space. I've known Fiona since I started working at VaultFast back in 2017, and she's such a fantastic source of knowledge. She does loads of great research, and I really enjoyed this conversation. I'm sure we'll have Fiona back on again in the future. Check out the work that Fiona does in the description. Check out The Loop, it's a fantastic organisation. Also check out the Drug Education Forum, the details of which are in the description. If you're interested in the subjects that we discussed today, you can attend our events for free. We have loads of great speakers who will give you the most up-to-date and accurate information when it comes to drug education in the UK. Thanks so much for watching the show. Please like and subscribe, and see you at the end of the video.
Fiona, we were just kind of chatting about something really interesting off camera, some work that you've been doing looking at the average price of a dose of MDMA. Can we just start by you explaining what you discovered there, and we'll move on to the implications of that discovery?
Yeah, so I've been doing research on MDMA for over 30 years now, and I was interested in the relative price. And at the moment, depending on how many pills somebody was to buy, you would say, well, they're about £5 each pill now. And at the moment, each pill contains an average of 2 adult doses of MDMA. So we'd say that one dose is around about £2.50. Whereas if you go back 30 years ago, one pill would be usually one dose and will be about £15, maybe £20 in London. And in today's prices, that would be £50. So a dose of MDMA has gone down from, in today's money, £50 to £2.50.
That is absolutely wild to think of it like that. I did a show with Nick Hickmott recently where we were talking about just the rapidly changing way in how drugs are sold, and that sort of free market, the ultimate free market, no regulation, prices go ever. And drugs are just completely unaffected by inflation. But what you're talking about there is not just not affected by inflation, but a huge drop in price. What do you think the implications are on young people for that? Like, okay, so there's a huge drop in price. What's the result? What's the sort of outcome from that?
Yeah, I think a couple of things. First of all, when you've got that massive drop in price combined with easy availability, access on apps on people's phones and things like that, it means that relative to alcohol, it's fairly easy to get a hold of for pocket money prices. And as we make alcohol more difficult for people to buy, particularly in pubs and bars that ask for ID, it means that they're more likely to be driven towards the illegal market where they don't ask for ID, and generally dealers don't care if they're selling to over or under 18s. So I think there's that issue around access and availability. But also I think in terms of the price, if you think in a festival, you could be spending £6.50, £7 on one little bottle of beer, 330 millilitre bottle of beer, equivalent to 2 or maybe even 3 doses of MDMA. So if you're looking at sort of a cost-effective night out for a young person, particularly with the cost of living crisis and limited disposable income, it's much cheaper for people to have a night out with MDMA than alcohol. But the big concern in relation to that, of course, is that you don't know the strength of the pill you're buying. You don't know what's in it. If you buy alcohol, if it's the strength, is it beer or is it whiskey or is it gin and tonic or whatever? If you buy a pill, it might be the average of 2 doses. It could be less, it could be more. And that's got implications in terms of us having amongst the highest MDMA death rates in the UK that we've ever had.
Mm. And how long has that been the case? Obviously, you've worked in this field for You've done a huge amount of research. You've been tracking that for a while. How's the UK done historically with regards to MDMA deaths and overdoses, and where you obviously you sort of given an idea of where we're at the moment? Not great, but historically, kind of what's been the scene?
Yeah, and if we look back over the past 20 or 30 years, generally prevalence of use has sort of fluctuated, but more or less similar levels, whereas the drug-related deaths have increased, disproportionately over and above use. So drug-related deaths are not going up because more people are taking it. They are going up independently of that. And if we look at the strength of pills, we can track parallel increases. So it seems to be that as the strength of pills has increased, so the deaths have increased. And this is really about dosage, the dose makes the poison. It's simply that people do not know how strong they are. And that's a real concern for me in relation to young people coming through. And that's a simple drugs education issue, is how strong are the pills? Can we get the message to people? And can they apply that message and understand it in relation to things like average adult doses, but also body mass index? Are they male or they're female? Perhaps if they're more experienced user, they might have a higher tolerance, all of those sorts of issues. So it can be not necessarily just a simple equation, but it's a conversation that somebody involved in drugs education could have with young people about all of those factors.
And I've always thought that's been one of the biggest challenges amongst young people, not just young people, but just drugs in general, is it is complicated. Like someone's experience of a drug, whether it be MDMA, a psychedelic, whatever, insert drug here, it's dependent on so many things, right? The classic drug setting model, what else you're putting into your body, how you're feeling, just your biological makeup. And I think one of the biggest challenges we still have, or have always had in drugs education, is getting some of those nuances and complexities across. You and I have done loop events with yourself and kind of sat in front of young people who will, plan on taking a multitude of drugs. And they're very excited about it, but they have absolutely no idea how they all interact. They've absolutely no idea that MDMA and alcohol interact with each other, and their experience will be very different. Ketamine and MDMA, ketamine and alcohol. So there is this huge challenge, isn't there, to try and get information across in a way that is relatable, they can understand. I guess that's been one of the biggest challenges in the work that you've done. How do you get that complexity and give it in a way to young people that they pay attention and absorb it?
Absolutely. And I think one of the real benefits of drug checking as a health service is that people come in and they will drop off a sample. It will be tested by the chemists, but then they sit down with a healthcare professional, drugs worker, pharmacist, doctor, nurse, and so forth, and they have that dialogue and they can ask questions, and that's so important. So they don't just get a test result online or in an envelope or something like that, but they have that opportunity to ask questions in a non-judgmental way. And also it's anonymous. We genuinely haven't got a clue who these people are when they come into the service. So that frees them up really to ask the sorts of questions which we know they don't ask their GP or whoever, because we say, have you ever spoken to a doctor or a nurse about drugs or alcohol before? And 95% of the people who use the Loop service say, no, we never have. So, we're really capturing people who don't use drug treatment services because they don't think they've got a drug problem. But they do have drug questions. And as you've said, about drug interactions, lots of questions about that. Also about how illegal drugs interact with legal prescriptions. Lots of young people are on SSRIs or maybe on a contraceptive pill or things like that. And so they've got questions about that. And one of the things that we didn't expect before we started delivering drug checking festivals was how many young people stop their prescription medications before they go to the festival because they know that they're going to be taking illegal drugs at the festival and they're worried about unknown interactions. So you can see from that they're trying to be sensible, as they see it, and to avoid the worst adverse reactions. But they don't, they'll come in and say, we don't know the implications of stopping whatever, the prescription drugs are, which is obviously a worry.
Yeah, I think that's such a precious part of the work that you do, that kind of interaction where the person's in a space that's non-judgmental, it's completely safe. And it's not like it creates a non-judgmental approach, not through just reassurance, because that's what people try. You go see someone in a drug treatment service or wherever, they'll say, don't worry, you can talk to me. And they're not lying, but really? Whereas if they've just had an interaction in which they can clearly see them and others, drugs are being tested, you genuinely can sit in front of me and you can be very honest. We can have a great conversation in which our sole focus is making sure or doing as much as we can to give you a non-problematic day or festival. And one thing, and I know you've talked about a lot, the safest thing anyone can do is not take a drug. The safest, the top piece of advice is just don't do it. But if you choose to do it, here's all the information that you need, or here's all the information that's used.
Absolutely.
So I think that's a very precious part. And I think I'm glad you brought that up, because I think that's something that people, that they hear drug checking, drug testing, and they think, oh, that's where someone gives you drugs to tell you what it is. Well, that's one piece of it. That's one piece of a much broader interaction. So yeah, when going back to kind of like what did you say it was, £2.50, £2.50?
Yes, about £2.50 for one dose of MDMA at the moment.
With that in mind, what do we do about that? So, like, if we're thinking about drugs education, and we're sort of combining that with the point that you've just made, that drug-related deaths in the UK are problematic. What do we do with that information? What do you think education interventions look like with that fact?
Okay, I mean, so for me, because I'm a drugs researcher and I'm not actively delivering services, and I don't deliver the consultations in the space, so this is really me with my sort of academic hat on, but thinking the important things are being accurate, non-judgmental, and I think really having that sort of contemporary evidence-based knowledge, because drug markets change so much, and I think it's really important for drugs education to be believable, for people to be able to act on it. They've got to be accurate messages, but also they've got to be appropriate to the age group. And I think another thing that's important is that they've got to have the right balance between not being overly simplistic and not being overly complex. I think the people who are delivering these services, they need to know what their messages are in relation to that. And at the end of the day, one of the things that's really heartened me is that most people do want to keep safe, and most people do want to hear those messages. So in some ways, I think you're knocking on an open door if it can be pitched in the right way, that absolutely people are hungry for this. My day job, I teach students. I have a third-year drugs module for third-year undergraduates. And so I'm discussing these sorts of issues with students every day. And still they talk to me about the lack of school drugs education, or that it was still just say no, when many of them had already said yes. It was closing the stable door after the horse had bolted. And it might be that they missed drugs education on that day. So, I'm not saying that necessarily they're giving, a fully accurate view of what happened at their school. However, it still concerns me that things that haven't really moved on much since, in the past 20 years or so, whereas drug use has massively moved on. Talking about all the different markets and access and prices, that all these things are already easily available if people want to take them. The interesting thing, is not all of them do as well. And if we look at alcohol, we've got a situation where nearly 40% of young people aren't drinking alcohol. So
why do you think that is? What's your kind of take on that as a piece?
I mean, there's all sorts of things happening, fascinating things happening. I mean, I think part of it was, there was a massive increase around sort of the binge drinking decade, late 90s, early 2000s, where alcohol was seen as exciting and fun, and the cafe bars opened, and all these new spirit mixers and these different alcoholic beverages. So we had this flourish, if you like, of the alcohol industry, developing alcoholic products and venues and all sorts. So I think it was inevitable that would have peaked and declined now. But also I think we've obviously got other alternatives. So people go to gyms and coffee shops and ice cream parlours and all sorts of other places now where they didn't. And people socialise at home more, buy alcohol to drink at home, less, off licence than on licence. But I think another key thing will be the focus on health, fitness, well-being, and social media bringing a self-consciousness around what people look like, how they behave, wanting to present the best selves online. And the implications of that being that it's no longer fun to post videos online of being drunk and in a gutter in the way that people did when Facebook first developed. But I think, alcohol and the pub are not so important to young adults as they were, say, when I was their age.
Yeah. What's your kind of, I agree completely. I think it's a great explanation of it. What do you think young people's kind of perceptions are to drugs? So you kind of talked there about that sort of changes and shifts that have taken place with alcohol. Do you think similar changes and shifts have taken with MDMA, ketamine, kind of illicit drugs? Are those people that are avoiding alcohol, are they making the same decisions around illicit drugs?
I mean, I think some are, some aren't. If you go to any festival, you can see that there are plenty of young people who are, experimenting with illicit drugs, whether or not they're drinking alcohol. But then some of these won't fit very well with alcohol, as you alluded to before. So, for example, ketamine, which is very popular at the moment, doesn't at all mix well with alcohol, and people will be aware of that. But if we look at, your broader question about, I guess, cultural shifts in terms of different drugs, ketamine's a really interesting one, because when I started doing research, ketamine was very much a sort of countercultural drug of alternative scenes, squat parties and psytrance and things like that, very specific. And then it started to broaden out a bit to trance and to hard house and like a wider number of electronic music genres. But even then it was contested. And I remember clubs saying, oh, like stop ketamine being on the dance floor, and it was just saying nay, as in, horses. And, a pushback to saying that ketamine wasn't appropriate and people didn't want it in their clubs, in some of the clubs. Or if people did take ketamine and were stumbling around the club, other people would sneer or criticise, it wasn't seen as welcomed at all. Whereas now it's become mainstream, and when we look at, because I do research in festivals every year, looking at prevalence of use, and ketamine is, pretty similar to cocaine and only slightly lower than MDMA now. It's become massively popular, and the age range has gone lower as well. So, if it was sort of 20, 30-something countercultural groups, now we can see it right down to people in their early and mid-teens. And also, I think the reasons for taking it have changed as well post-COVID. So, as opposed to being just half an hour of silliness in the chill-out party, people got into taking it in the bedroom by themselves, daily dependent use. And we're seeing that come through now to A&E, to teenagers with, an ulcerated bladder, and some even having to have surgery to have their bladder removed. So there's a concern around the age falling, it broadening out, it becoming much cheaper, £5-10 a gram in where I live in the Northwest. But also I think that daily dependent use and the physical repercussions and how that links with socioeconomic deprivation, that this is related to poor areas and to people who are feeling disillusioned and forgotten.
Yeah. I've always felt that's one of the most important points that we need to make around drug use, is that there's this kind of like societal social perception, the kind of this simplicity of drug use around dependence or even around, to some extent, people's enjoyment of what you might describe as a recreational relationship. Even you view use of a drug as recreational, there's still something about that experience that is doing something for you, and your experience is based on a whole load of things, your upbringing, your mindset, things that you might be experiencing. I think that has always been an area that we've not done a particularly good job of, both in educating people on why people use drugs dependently. And at the sharpest end of that spectrum is heroin use, isn't it? Like the sharper end of the spectrum. But people, spent many years working in drug treatment. People using, well, it'll be no surprise to you, people using heroin because they're processing pain. They're in pain and they want that pain to go away, so they take the best painkiller that we have. And you're kind of talking there about ketamine, that you're describing again, people's isolated use. I imagine that's escapism. That's kind of using a drug in isolation at home to get away with what that day would look like without ketamine, right? Just kind of an escape from an experience.
Absolutely. And I guess that links then into the whole idea of self-medication, that people self-medicating for whatever problems they might have, and that could be physical or, it could be psychological. And clearly we've got a generation who were deeply traumatized by COVID in ways that we're only just starting to realize. And I can see it in relation to my students as well. But going back to your question about drugs education and thinking about what you said then, I guess part of the challenge is to unpick that, isn't it? Is what are the benefits of taking any medication or drug, whatever it might be, regardless of legal status? What are the problems? And, that cost benefit analysis, and getting young people to think about that for themselves in a way, I guess, to have those conversations to help them tease out what are they doing and why are they doing it? Because that will help them understand better. And then, the idea is we want to steer young people, accepting they're going to be experimenting. Some of them will be experimenting, but we want to steer them safely to adulthood through these ways of experimentation and out of the other side as best that we can. And that involves honest conversations, but it also involves having that sort of, for them to have that self-awareness as well of what are they doing, why they're doing it. And, often drug use is a symptom of other things, as you've touched on. It could be trauma, it could be self-medication, it could be escapism, all sorts of things. And it could be different on different days as well.
Yeah. I've always felt that sort of like the the drugs education discussion kind of splits down the middle. You have kind of urgent information that needs sharing with people who are about to use a substance. It's kind of like, look, if you choose to do this, here's what you need to know right now. This is really, really important. You need to know about drug interactions. You need to know about dosage. It's basically the drug setting pitch. You need information from all these three spheres really quickly to reduce the chance of a problematic experience. Conversation number one. Then there's this other conversation that's like, okay, bigger picture stuff, a deeper understanding of people's relationships with drugs, which might infiltrate that kind of, people just using drugs at a festival, but it's certainly more appropriate for the regular use. Do you think ketamine? Ketamine, I think, is a really interesting drug to talk about at the moment because it's been discussed at a government level. There's, you've done a lot of work recently on ketamine. You've been involved in documentaries very recently on ketamine. Where do you think we're at the moment when it comes to ketamine in the UK? Do you think this is an issue and a problem that needs a government intervention? Is it an education intervention? Where are we at with ketamine, and what do we kind of need to do about it?
Well, I mean, I guess all the things, in relation to the situation. I think, education, conversations, we need more money going into harm reduction, into treatment. What's clear is people are now, it's got to a situation where there are enough people with serious enough problems that they're going to A&E and at a younger and younger age, and more are. So, that needs to be addressed right through all the pathways, really, from people with that initial experimentation right through to people who have serious physical problems and are facing life-changing injuries because of it. The difficult thing is, because the current debate is about classification, should it go up from B to A? And what I would like to throw into the mix is, what's the purpose of that? And what is the aim? And if the aim is deterrence, we have to look at to what extent the people currently using ketamine will be deterred by it being Class A. And one of the things I'm interested in is, okay, how many of those people are already taking other Class A drugs, cocaine and MDMA, or how many of them don't and are genuinely deterred by that Class A status? And there's also a debate about if you make a drug Class A, it brings in more violence in the supply chain. So potentially you might reduce a few people who are taking the drug, but you massively escalate the involvement of organised crime because the drug is more risky to be moving on the supply chain. So there's more profits involved, and so you're going to have more OCGs involved, more violence, all of those things. So it could potentially lead, and I know this is Neil Wood's argument, that it could actually lead to far more harm, like serious organised crime in terms if you move it into Class A category. So you have to think about that. And then you also have to think about the longer term consequences of criminalising young people with Class A and, potential curtailing of future employment opportunities. So it's a really, really complicated thing, fascinating. I don't think there are any easy answers in relation to that. But what I would hope with an ACMD review is to really look at all of that and not just the idea that Class A makes it, a deterrent and it will automatically lead to reduced prevalence of drug use. Because I sat on ACMD when there was the review of it going from C to B, and it was, it was along those lines. There was a hope and an assumption that by it going to B, it would reduce prevalence. And what we found was that actually in the 2 years after it went up to B, prevalence of use doubled. So it clearly wasn't a deterrent. Yeah.
The evidence is there, isn't it? Really, the sort of the picture is there if people want to go find those answers. Whether that'll happen, I guess we'll have to see. So you talked about MDMA, you talked about ketamine. One drug, I guess, that maybe hasn't dropped so much in price but has remained stable is cocaine. But again, that's a drug that is certainly more common now amongst young people than it was historically. Historically, a drug that was seen as very expensive, a bit more kind of like, I don't know, drop too many stereotypes in here, but basically a drug that had more affluence attached to it. But very, very common now for young people to use cocaine, take cocaine. What do you think some of the changes have been? Why do you think that's taken place? Because that's not something that's dropped in price, has it? Really, it's not become a more affordable drug.
No, I mean, I think we've got more differentiation in that market now, in terms of like different levels of quality of the drug and whether people are going to chip in with their mates to buy higher quality cocaine. I mean, at the highest levels, it's very, very high purity, that extraordinarily high compared to 20, 30 years ago. But I think we've got more choice now in terms of the cocaine market. If people want, the cheap or the expensive, higher quality cocaine, if you like. So that, I think that's a key thing. Access to it is another thing. It used to be fairly difficult to get hold of, but again, with things like Telegram and other apps, it's so easy now for people to get a hold of it. And,
Yep.
you see more like organisation of people chipping in to buy it, as opposed to, it used to be that people would buy it in a club or a bar or somewhere like that and maybe ripped off and, it wasn't what they thought it would be. Now, when you have the buyer interactions and the buyer reports, and feedback and things like that, is people are much more likely to be getting higher quality cocaine and not be ripped off. So I think that's probably given some confidence to the market, and I think that's been a thing. But I don't get the feeling that people are, when we do our annual festival surveys, there's not people are not really in love with cocaine, and it's not the excitement and buzz around it I think there was 20 years ago. That it was seen as this glamorous and exciting drug. I think it's one of the things which is, it's there, it's on the menu now, and that people will sometimes have in certain situations. And there's definitely a generation who's come through for whom it's their drug of choice, but not necessarily so much for young people. It's a complicated picture. There's access to a lot of drugs, lots of interest in the psychedelics, in 2CB, things like that. And so, yeah, I think it really depends on which age group you're looking at, which demographics and things like that.
Yeah. You touched on a really interesting point around the kind of broadening of the menu. So like me and Nick talked a little bit about this, like the drug dealer of old would sell a drug and that would be their thing. Whereas now it's a menu of drugs. And I guess we're seeing the impact of that on young people, that maybe there's that kind of like breaking down of subcultures. So you talked about the history of ketamine and it having very specific subcultures. But I guess if that drug finds itself alongside cannabis, MDMA, cocaine, everything else, it's kind of maybe doesn't feel so much like a subculture drug. It's like, oh, right, well, everybody must use these because it's all here on the menu. So I guess there's that kind of normalization of drug use rather than it being a subculture of drug use. And I imagine you've kind of seen that in your work and research, that diversification and normalization.
Yeah, definitely. Because we started off discussing normalization. It's really mostly relating to cannabis, but seeing that now. And I think I was talking with a school teacher not long ago who said that it used to be that when he caught kids in, the playground and in the toilets taking drugs, it was cannabis. But at the moment, it's all ketamine. People are doing bumps of ketamine before they go into the afternoon class, and then teachers are trying to make sense of teaching them when half the class is on ketamine. Now he was talking about an inner city school in the Northwest, but nevertheless, I think the fact that kids don't walk around with cannabis so much anymore, and the ketamine is the drug of choice for some in the school at lunchtime is pretty extraordinary. More broadly, though, when it's talking about subcultures, is interesting because I think really we can see. I was reading in relation to music that we don't have that sort of investment in one genre in the way that people had maybe 20 or 30 years ago. This is the Spotify generation, that people will have a pick and mix between, one song by one artist and one by another right across genres, might not even be aware of the genres, that literally it's that sort of idea of taking what you like. And that's very different to say, going back to the whole idea of subcultures in the 50s and 60s, where people would be invested in a type of music, a type of clothes, type of shoes, a haircut, and drugs. And it might be alcohol, it might be amphetamines, whatever, but that you had a commitment to that whole package. And, you would be mixing with other people with a commitment to that whole package, that whole subculture. And it had a political meaning for you as well, that you were resisting mainstream culture, whatever that might look like. And that, and that came around in ways right through until the 1990s, really, until rave. But then we haven't seen that. Now we just have different neo-tribes, if you like, or scenes. But you don't really have that massive commitment to subcultures anymore. Perhaps, though, unless some people will say that some goths might be the case. But generally, you don't have that 24/7 buy-in to a subculture in that sort of way.
That's such a fascinating point and discussion, how the sort of change in music scene, because that I think it's another thing that people don't appreciate or understand about drugs, that infiltration of drugs into popular culture and the relationship that then has on people's use. And again, something that I've touched on with a few people on the show is how in a digital world young people can access because drug use isn't now this kind of little subculture thing. It's just out there on the internet. You just go find out about it on the internet. It's not like this secret, like whisper on. You could just Google it and go find out about it. You could go watch videos of people taking it. It's so clear to young people what these drugs are and what they do, that there's this necessity for drugs education and policy to catch up with that reality. But we're still back here. We're still in the past, thinking that there isn't that disconnect. And young people, because you can't say no to young people anymore, because they instantly know that that's nonsense. They can instantly just go on Google and YouTube and learn about drugs and all those, I guess, like policy, social changes that are occurring around the world with regards to psychedelic drugs and everything else. It's so important, isn't it, that drugs education catches up with the work that you do, the research that you do, and the reality of the situation, because there is this massive disconnect. So yeah, I think that's really interesting point around subcultures. I really want to ask you about just get me up to speed with generally where we're at the moment when it comes to drug testing and drug checking. What's the current situation in not just the UK, but in the areas that you're involved in, where we are?
Yeah. So, in the UK, we had 3 years of full drug checking at festivals that you were involved with, which were very successful. We evaluated them, published, were very excited by the findings. It surpassed, all of our hopes and expectations. Then we applied for Home Office licenses. That took a while, partly because of COVID, partly because there were lots of negotiations behind the scenes in relation to that. And then we got our first license in 22. And then with the previous Conservative government, they imposed some additional licensing conditions. And now we're currently conducting drug checking in one city, which is Bristol, once a month. We will have some very exciting announcements and news in the next couple of months for more cities. And in Scotland, separately, the Scottish government has been working hard to be introducing drug checking in 3 cities. And they're very much hoping to have one in the same building in Glasgow as the current drug consumption room, which absolutely makes sense, really, that you want to be testing, people want to be testing a substance before they're injecting it. There's no point injecting and then waiting to overdose and then having medical assistance. You really want to know beforehand if what you're injecting actually turns out to be nitazenes instead of heroin or whatever. So we're expecting and hoping within the next few months that we're going to move from one drug checking service in the UK to a whole number of them. And I think the focus at the moment is on city centres. And I think that's fine, because we really, at the end of the day, my hope is we have universal access to drug checking and that it's free at the point of service delivery, non-judgmental, anonymous, and that anybody in the UK can access it. And, that's going to take a while. But my view is that, at the end of the day, it's a small outlay which saves money. If we want to look at it purely in monetary terms, it reduces hospital admissions and it will reduce drug-related deaths. So it's a very economic way to be doing the right thing. This is about preventing overdose, preventing poisoning. So that's where we're at. We currently can't get a license to do festival drug checking, unfortunately, though. And I say, unfortunately, because I think festivals are a great place to do drug checking. And part of that is because for UK festivals, people will be there for several days. They've probably got a bit of time on their hands in the daytime, kicking their heels, looking for things to do. And they saw the loop as part of the festival experience. And we found people would queue up for, hours in the sun and rain. You saw that yourself.
Yeah.
And would really engage in a productive way with the service. And particularly so like on a Thursday, they'll come and put a tent and then they will come and visit the loop. So that's a fantastic place to be engaging with people. Also, we found that 95% of the people who use the service had never spoken to a health professional before about their drug use. And we were able to take drugs out of circulation. So if the drug was not what they thought it was, then I think about half of them would throw it away or give it to the loop.
And it's worth important to people that don't know, all the drugs that are handed in tested are destroyed.
Yes, that's right. Yeah,
so
we never give
that as well.
back.
So it's everything is handed in, plus people going, I don't want that experience. I'm not going to use that. Use that substance. And the amount of people that I would speak to who would then reduce what they were going to do as well. So it's not even. So it's 1, drugs taken off site. 2, drugs are thrown away. 3, people use less. Good drugs education, good harm reduction results in people using less drugs. Like that's what happens when you educate someone on the challenges and the risks, and they go, okay, I'm going to take decisions to better look after myself. I'm going to change my behavior.
And I think that's a really good point, in relation to taking less. So when we told people about the strength of the drugs that they brought in, 2/3 said that they were going to take less. And usually, because we checked this, it was people who brought in stronger above average strength drugs, and they were going to moderate once they realised what an appropriate dose was. And so there you've got a situation that you're reducing risk of overdose. Just simply that. And that matters because at the UK at the moment, I've done some research on this, about 5 people die from drug-related deaths at festivals every year. Most of those are MDMA overdose. These are totally preventable. They're usually young people early in their drug-taking careers. They've probably got low tolerance. Just last week, there was an inquest of a 21-year-old who died at a festival. He'd quadruple dropped 4 pills. Well, at the moment, a pill contains on average 2 doses. So he might well have taken 8 doses in one go. And, my heart goes out to the family. This is totally preventable. If, you can be on site testing the drugs, putting out alerts as we do on social media, letting people know, asking them to be careful. And really, if you're talking about drug education, this is the simplest win, really, is to be getting that information to people to save lives. Because we've got one of the highest drug-related deaths on record. And in Europe, we've got like over 5,500 people die every year in the UK. We can make substantial inroads into that if we get that information to people. They don't, nobody wants them to be dying.
No one wants that experience. Yeah, I could not agree more. I think that is such a hugely important point, not only on just the tragedy of how preventable. It's preventable with such a simple piece of information.
Yeah, absolutely.
It doesn't require that complicated nuance. It's just like, these drugs are really strong.
Yeah,
you need to, you know what I mean. You now need to be aware of the strength and the implications that can have. Because when we look at these deaths, you're right. It's not complicated. It's quite clear what's happened.
Yeah,
Taking too much MDMA.
I describe drug taking as the canary in the coal mine. That we can flag up really high strength substances, but also we can flag up if there are any adulterants, if there are synthetic opioids in circulation, because that's obviously a big concern at the moment. And drug checking is one of the few things which can flag up these concerns beforehand, before we have a situation of a whole bunch of overdoses in a city, that we know what's in circulation. And the unique value of drug checking is not only we testing what's in circulation, but the person who brings it in says what they bought it as. So we know that whether they have been missold it or whether actually this is actually, the drug itself. And unless you talk to that individual, you don't know what it was sold as. You can guess, but you don't know. Yeah. And we saw that with the 2 clubbing deaths in London recently. There was a whole lot of speculation that these nitazines have been missold as ecstasy tablets. But we don't know that. We don't know what they were bought as. And it's, it's highly unlikely that that's the case, because they didn't look like that. They didn't look like they were pressed to be ecstasy tablets. They looked like they were pressed to be fake benzodiazepines. And that, the likelihood is that they were taken by the clubbers for after a night of stimulant drugs, to get to sleep. And so it's really important, because if you want to have appropriate drugs education and harm reduction messages, you've got to target it to the correct people. So you need to know that, and so that's where I think drug checking is really valuable, is it can target the messaging to the correct people as well.
It gets that information. So no, it's tapped in. It's tapped into the front line of people's use of drugs in these environments. And I guess you get that information, you get that intelligence that you can then use to educate peers. One thing I've always loved about those interventions is someone comes in, the drug is tested, they have that interaction, that intervention and discussion, and then they go tell their friends that information. So there's this concept of you see X amount of people, but those X amount of people have then spoke to X amount of other people, because what we're not finding is people that come into drug checking and they go, I'm the only person using this in my friendship group and no one knows I'm doing it. I mean, I'm sure those people exist, but it's the overwhelming majority of people that come in, it's a thing it's in their culture, it's in their friendship subculture. It's normalized. It's normalized in the festival. It's normalized in their group, and they then go and say, "Hey, did you know that? I just found this out. Did you know how this interacts?" And then that information is seeping through and spreading. I think that particularly that sort of peer-to-peer education then helps break down some of the barriers and challenges that adults experience. Right? It's just that peer-to-peer education, I think, is absolutely amazing. One thing that people might not appreciate or understand is how are could you just describe how some of those tension points are managed when talking to young people about drugs? So what steps and lengths do you go through to make sure that those interactions and those discussions are helpful and appropriate? Just tell us a little bit about how those sort of things take place.
Yeah, I mean, the first thing to say is, I don't deliver those. So we have only healthcare professionals deliver them. And these are people who are used to giving out, clinical test results. And they'll start off by asking about people's medical history and their drugs history. So they've got that background information. And the idea is that it's individually tailored to that person, appropriate to any medical conditions or, past relationship with drug use, whether it's short, long, problematic, unproblematic, things like that. And then in the course of the healthcare consultation, they will be talking to them and assessing the relative risk, because I think the main thing is this is about communicating relative risk. And it's not it's not a chemistry experiment, as in just finding out the latest molecules. It's about thinking, how can people operationalize this in their life in some way? So it's that, as I said before, it's having that sort of clear and simple message in terms of it. But it's, it could be, for example, in relation to MDMA, you're thinking about quarter pills and half pills and, all those sorts of things. You're thinking about, method of administration and dosage and, people having sort of moderate and what's the word I'm looking for? Staggered intake, that those sorts of messages as well. But, for us, from a legal point of view, we can't be aiding, abetting or assisting future drug use. So, we have to be careful around the legalities in relation to that, whilst equipping people to keep them safe, as you said, as safe as possible in relation to any future decisions that they might be making. The other thing to say is that, going back to your point about friendship networks, you're right, there's a great cascading about the information that's received, but also at the consultation in the drug checking space, they're almost rarely alone. They come with somebody else, at least in 2, sometimes 3s. Sometimes we've had up to 8 people, and they've all got questions. And the questions are often really, really broad ranging, and will be, how does this drug interact with this? And, that could be about their, medications, prescription medications, those sorts of things. But also it could be about medical conditions. So we've had people who've come in and discussed multiple sclerosis and how does that interact with drugs and things. So I think there's a massive appetite to be hearing about the drugs, the illicit drugs, but there's also a massive appetite for wider health questions. And so I guess that's one of the things in relation to drugs education is it's an opportunity for young people in particular, I think, but also drug using communities more widely, to have questions about health and well-being that they haven't yet asked a medic. A lot of people can't get hold of a GP, they might not be registered with a GP, all sorts of things. And so once they have one sitting in front of them, it's a tsunami of questions about their health, which is pretty extraordinary. And often our staff have to say, after a certain amount of time, we're really, really sorry, but there's a massive queue outside. We've got to let you go and see the next person. But I think it just shows the appetite to learn about their bodies that young people have, which is, very, very, very impressive. But so I think, key things being non-judgmental, being anonymous, as we've discussed before, and having just, opening the door to listening and seeing whatever the problems are.
And creating a space where people, those demographics of people can have a conversation, because where else do they have it? Like they're not going to drug treatment services typically unless they're dependent or problematic. And I know there's many, many great drug treatment organizations up and down the country trying to engage with everybody that interacts with substances, with drugs. But the festival goer that wants some information and advice around their use of whatever drug it might be, they're not going to drug treatment organizations. They're not talking to family members, to pair. It's one of the only spaces I can possibly think of by which that demographic of people who are at risk of serious adverse effects, who you mentioned on average 5 people here, where else are they going to go? Like that, it's the perfect environment and perfect interaction to help that group. And I think that the other thing we've both kind of talked about with each other and in other spaces in the past is you have to engage with the world as it is rather than how you want it to be. And the way the world is, young people are using drugs at festivals en masse, whether you like it or not. I mean, no matter who you are, that is how the world is. And in that reality, despite everything that takes place at the gates of the festival or wherever else, that's the reality of the situation. So let's do our best to prevent. Let's with that being the reality, let's do what we can to help young people. And I think that as an intervention, I can't think of anything better, because again, we won't open this sort of box here, but putting more dogs on the gates is not the answer. It's not. I know what we do. Let's just crank up the enforcement. No, that's those interventions are not. It's not more of that. It's a diversification of what we're offering.
Yeah, we could do a whole other podcast on dogs. Happily, would do another podcast on dogs. I'm doing research on it at the moment. It's fascinating. But yeah, just to pick up on a couple of things that you said there. I think, in terms of the point about this is where else does this happen? They may have variable quality input in schools, and that is quite variable. They may have some input and support at university. I think universities are getting better at that. We've got Universities UK now steering universities more towards a harm reduction approach. And then you have drug treatment for people who are, seen to be for people in the 30s and 40s, by and large, opiate dependent. And then you have this gap of people in their 20s and 30s. And so absolutely, you want to be capturing them where they go. And the other thing to say is where they go now, it's festivals increasingly. So the event industry did a survey I saw not long ago, and they asked young people, would you prefer to go on a Mediterranean holiday with your friends to Ibiza, dance type things, or to go to a, muddy, wet British festival? And 2/3 of young people said a British festival. That times have changed, that people don't so much want to be going to Ibiza or wherever. And festivals are one of the things that young people save up for. And people can say, oh, it's a very privileged group of, middle-class, middle-aged people glamping at Glastonbury. But there's a festival out there, covering every music genre, every entertainment style, but also every pocket. Because if you look at a lot of the festivals, they now have like monthly and quarterly payments. They have payment plans for people. They recognise that they're expensive. But the other thing is you have a lot of one-day festivals now where people don't have to have the outlay for tents and camping equipment. They might not want to be camping. And you think about the sort of one-day festivals in big city parks as well. Now, that is no more expensive than a night out clubbing. So I don't agree with the idea that there's some sort of rarefied group who go to festivals. The festivals that I go to, the city ones especially, these are just normal young adults who would otherwise be going clubbing. But instead of going out at night, they want to be, going out and sitting in a park and doing it in the daytime in the summer, combined with the fact that we have, increased temperatures due to global warming, is that summers in Britain are changing, and they're not quite the cold, wet, muddy downpours that they were always used to be.
Yeah, I agree completely. And I think that kind of the sort of class-based argument around the issue, it feels a bit lazy to me, and it feels a little bit out of touch of reality. It's that kind of, I think that's more people turning their lip up. That's more like a Glastonbury slur, as people go, Glastonbury, rather than like, well, hang on, okay, fine, whatever about Glastonbury, but yeah, zoom out a little bit. There's a cultural thing here going on with young people. It's not just Glastonbury. Yeah, and you're absolutely right. People save, and everything's on a payment plan anyway. You can get Deliveroo's on Klarna. I saw the other day you can get a takeaway on paying installments for a Nando's. I mean, that's crazy. If you get any for Nando's, you get any for your tickets for festivals. So yeah, it's a very, very accessible endeavour, I think, for young people to do.
Yeah, and they look forward to all year. I go to enough festivals and talk to enough young people that I know how much they look forward to it. It's the big event of the year. I'm going to Boomtown next week, next Wednesday, and there'll be people who saved up all year to go to Boomtown. Yeah.
And that's why the message is so important, because people, people put a lot of planning, a lot of effort. They want to have a good time. So that's where the opportunity to have a sensible conversation about their experience. It's not just something to do every weekend. And if it goes a bit wrong, whatever, I'll do it every weekend. And what I'm doing, it's like, oh, okay, no, I don't want to. I want to enjoy these days. So I think that does open the conversation. Fiona, I really appreciate you getting into it. We've covered a lot there. And please, can we do another one about drug? I think that is such an interesting conversation around sniffer. Is it the right term? Just a
drug detection dogs.
Sorry, you know what I mean. A drug detection dog. I would love to, because I'll tell you one very quick anecdote to finish on, and then maybe the next podcast we can start it by you telling me whether I'm completely off the point. But I was in a rave not so long ago, and there was a drug detection dog on the thing, and I was sort of going, these things, they're useless. They've no idea. They're completely ineffective. And then the dog literally just got person after it did a run of about 6 people. And my mates were laughing at me, being like, "You've just, you've just that's your fault." You say that it won't. And every person that got caught, they clearly did have, they were clearly absolutely bricked it and got taken off to a thingy. So yeah, I was very skeptical about it, but when I saw that, I thought, oh, okay, maybe they're useful. But I imagine there's more nuance to it. I imagine it's
Yeah, it depends on the dog. It depends how they're trained. It depends how old they are. Depends if they're police trained or private security trained.
Right.
Are they trained on actual drugs or the scent of the drugs? And there's so many variables in it. Also the weather, if it's indoors or outdoors. And so I think people like to say drug detection dogs don't work, but it really depends on so many different variables.
They can work.
Yes.
They can.
Oh, absolutely.
And I imagine a lot of people just kind of like get scared and go, oh.
Yes,
I mean, like, and people sort of panic, and the dog's like, "Oh, you've panicked," and then
I mean, so there were all of the variables that you can measure, and then there's the impact on the people who are walking past for sure, and there's the sort of Russian roulette feel of it, that in itself has a big impact on people. They don't really know whether it works or not, but. That they don't necessarily.
It's not very fair. It's a very sorry. We're opening an account. We
are working.
It's not very fair intervention. Anyway, Fiona, really appreciate you chatting to us. It's been a really interesting discussion as always. I really appreciate your time.
My pleasure. Thank you.
Thanks so much for watching that episode. Like I said at the beginning, please check out the details of the Drug Education Forum and Fiona's work in the description. Like and subscribe to the channel for more drug education episodes, and we'll see you next time. Thanks for watching.